The U.S. Surgeon General is sounding the alarm about a worsening mental health crisis among young people. An advisory published Tuesday noted the number of youth experiencing depressive and anxiety symptoms doubled during the pandemic to 25% and 20% respectively. In early 2021, emergency room visits for suicide attempts in the U.S. were 51% higher for adolescent girls and 4% higher for adolescent boys compared to the same period in 2019. The Surgeon General says while the issue of mental health in children and teens is not new, it has been amplified during the coronavirus pandemic. For more, I want to bring in Dr. Jessi Gold. She is a psychiatrist and assistant professor in the Department of Psychiatry at Washington University in St. Louis. Dr. Gold, thanks for being here. So tell us why the pandemic has worsened mental health issues specifically for young people.
Yeah, I mean, I think if you think about all of your friends and family, it's worsened mental health. But in the particular population, the youth, they've had really bad mental health before the pandemic. And then in the pandemic, we took away a lot of their coping skills, their social supports, the way they go to school, the way that they, communicate with their friends. And they had to learn different ways to do that. I think that's been really hard. And a lot of people talk about being lonely. There's a role of social media in there that has been growing over time, but has some positives and some negatives, but hard to know how that affects, how that's been affected by the pandemic. And then, of course, things like gun violence, racism, all the rest of the things going on in the world that contribute to the way that all of us are feeling. But I often feel that young people feel things and feel things strongly, and it really affects them in ways that we probably don't even understand.
Yeah, it's important to acknowledge that it is something that is widespread, but there are particular groups that are being really hard hit. And according to the Surgeon General's report, minority LGBTQ youth, they are both at higher risk for facing mental health challenges, particularly during this pandemic. How much worse is the situation for these young people?
It's significantly worse. I think if you look at just even suicide rates over the pandemic, we were thinking what's going to happen, and the only changes have been in African Americans. So I think there's a big difference when we look at the rates of how it's been affecting Black communities versus LGBTQ communities versus white communities. And I think, again, it has a lot to do with these additional stressors that they face that maybe the rest of us don't face or talk about out loud. And then on top of that, there's a stigma to getting mental health treatment in certain communities that had existed for a long time, long before COVID. And I think it just gets amplified when you don't talk about it or you don't know how to talk about it, and then you feel worse, and so you can't talk about it.
Dr. Gold, I really appreciate you talking about how we need to say these things out loud. I'm hoping that you can also empower us with other steps that young people and their families can do to help improve and protect mental health and well-being. And that's true for parents as well as kids.
Yeah, the Surgeon General gives a really good breakdown of ways that we should be thinking about things for parents and kids, gives some steps. So if people have time, they should check out the report. But kind of in summary, talking about it is a very good step. Kids don't know that they can talk to you unless you talk about it in some way that they feel like they can talk to you. Talking about feelings openly, letting them have space for feelings, knowing feelings are normal, that not every feeling is pathologic, right? Not everybody needs to come see me just because they feel sad. Sometimes you just feel sad, and that's something we need to talk about. We need to talk about coping skills, what works for people. We don't teach that in school, so you kind of have to learn that on your own, and people often get those ideas from things like TikTok, and that's wonderful. But if that's not the thing that works for you, that the TikTok celebrity is doing, then you might need to think of something else, and you might need help, and friends and family can help with that. Also, just like paying attention and noticing behavior change and warning signs in your kid. I think, talking to your kids so you know what they were like yesterday and the way that they are today, and being open to asking them questions and checking in on them, I think is really important, because support from family, social support is particularly important, and especially in this time where we're lonely and taken away from so many supports.
What kind of resources do you think federal and local governments can provide or could invest in order to address this issue?
It's a really big question. I mean, I think we've been working on this for a long time, but I think if you look at things, we have a lot of crisis intervention and not a lot of prevention. And we need to get people before they need to see people like me. So we need to be teaching these things in schools. We need to be having people have access to school counselors when they're younger. We need to be getting people to know, okay, when I feel this way, I'm anxious. That's what I feel. This is how I deal with it. So then when they get older, it's not interfering with their life day to day, so they can't function, and then they have to see someone like me. So preventative resources, I think, is a really good place to invest. We also just don't have enough people providing care, and that's a pipeline problem. We need to think about how we can get more people to go into mental health, support them financially to go into mental health, especially school counseling. Think about ways that that can happen, especially in the populations you are talking about, because people want therapists that look like them, and that if we don't encourage it, they're not going to do it. And so financially investing in the pipeline, I think, is really important, and expanding other resources like peer resources, social supports and networks outside of doctors, knowing other places you can go for help, I think, is also really important.
Dr. Jessi Gold, it sounds so obvious when you say it, starting just with as fundamental a basic step as being able to take away the stigma and the shame and talking about it. Thank you.
Thanks for having me.